right, just thumbs up and I'll get us started. Welcome and thank you for joining us for our SIH Second Act class today. We are running virtual in January, just to remind everyone. I'm Kelly Corner, the Health Education Coordinator, and we do have our manager, Tracy Heron, online with us today. Yay, there's a little wave from her. We do want to welcome everyone, and we want to make a point that if anyone's new and this is your first time, we're glad that you're joining us today. When our speaker brings up her presentation, if you will scroll down below that, there's a space where you can add questions. And we love to have those questions. We would love to get them answered for you. So please type those in there and we will go over them at the end of the presentation. All right. Upcoming activities, I know there's a lot of changes. We have fixed this on our website. We've also made a Facebook post on our Second Act group. I'm going to tell you a couple things really quick. The Act It Out has been postponed. That's going to be on March 9th. So you'll see that back in a newsletter. The Gridiron Playing Field, that will be what you can watch instead of join us in making. All right. Our hands down class will also be rescheduled, but we don't have a date yet. The Want to Make a Snowman is canceled. All right. And then How to Use an AED will be on February 25th. So, because of the now in person activities, we are going to change up our January schedule. All right. At this time, I get the pleasure of introducing Dr. Melo. She is an SIU family medicine resident, and we're excited to have her today. She is continuing our series that dealt with um, actually doing health screenings, and then we moved on to now talking about the health risks that come either from biological and or behavioral portions. So we're going to pass that on. Dr. Mello, thank you for joining us and go right ahead.
All right, thank you so much, Kelly, and thank you all for having me today. I'm going to go ahead and bring up my presentation. All right. Okay. So once again, thank you all for having me. I'm sorry it wasn't able to be in person. I think we could have had a little bit more of an interactive session, but please don't hesitate to throw any of the questions into the chat, and that way I can address them while I'm going through. Definitely, you don't need to wait to the end. Sometimes it's easier to kind of hit them as we hit those slides. So definitely don't be shy. So we're going to talk about how risk factors affect your health. So some of the objectives I wanted to address was kind of define what is a risk factor, what are the different types of risk factors, what are some that are common for the different diseases that we may face, and then what are some health strategies that we can use to address those risk factors. So just one kind of disclaimer I do want to make, we'll be discussing diet, exercise, and other regimens to kind of address risk factors in chronic disease. So just depending on your current state of health, I would recommend just touching base with your doctor before making any large changes. All right, so we're going to kind of dive right in then. So what is a risk factor? And to put it just very simply, it's any sort of element, item, that predisposes a person to a particular condition. And we'll kind of get a little more specific than that, but that's just kind of generally speaking. So I thought we were going to be in person, and I thought that, we had the chat a little bit. So kind of wanting to think about what are some risk factors. So I like to just give everybody just a few moments to kind of think about maybe what are a few risk factors you've come up with just for yourself personally. And I'll give you a few minutes just to think about that, and then we'll kind of move forward. Okay. So I'm sure you kind of thought about a variety of risk factors that have come up in your health journey. And those risk factors really fall into two different categories. So they're what we call modifiable risk factors, which are risk factors that you can change. Those things we'll go into more detail. but an example would be diet. Non-modifiable risk factors are risk factors that you cannot change. And so that really is where your family history, your genetics start to come into play. And so we'll look at each of those a little more closely. But kind of just to step back and look at kind of the overall picture, for really every disease process that you see any one of your doctors about, if you have more than one, there's multiple risk factors for each situation. And at times it can really feel quite overwhelming. If we look over here for lung cancer, they list, there's at least 8 risk factors there that they've identified. Certainly there are more as well. If you look at our cardiovascular disease chart, there's numerous, and it starts to feel a little overwhelming. How do I address these with my doctor? How do I address these personally? And it can add a little bit of stress to your health journey. So I hope that we can kind of talk this through together. I can answer some questions. We'll work through kind of like a small case a little bit to kind of go through, well, how can we kind of chip away at these things and kind of feel comfortable with where we're going for each of our conditions. The one nice thing that I will say is that for a lot of the chronic diseases that we do see, so diabetes, heart disease, high blood pressure, a lot of the risk factors, especially the ones you can change, really overlap. So targeting some risk factors will target multiple of your conditions, okay? Any questions so far popping up?
I don't have
Okay.
any listed just yet, so
Okay.
we'll
I
see
will
what
keep,
comes up as time goes on.
perfect. I will keep going forward here. So we're going to do a little bit of a case kind of to work through. So I'll go ahead and read it. So John is a 65-year-old man. He comes in to see his doctor for a general checkup. He's not had any health issues before, and generally he's feeling well. Both of his parents had high blood pressure and heart disease. He eats just a regular diet, doesn't really do anything special with his food. He walks around his neighborhood a couple of times a week. He is overweight. He's struggled with weight for most of his life. He still smokes a cigarette or two a day. He does not use any alcohol. He is close to retirement, and his job has been stressful. When the nurse checks his blood pressure, it's 160 over 95. And he, says to his doctor, how can this be? I've always been healthy. What's going on? What can I do? And so, what I'd really like to do is take a few moments, kind of read through it again. I'll give you guys a few moments and see if you can pick out some of the risk factors that John has for his high blood pressure. And maybe if you can throw them into the chat and then we can start kind of going through them together. So take a moment, read back through and see if you can pinpoint what are some of the risk factors for his high blood pressure based on what you guys already know.
I did get a couple of comments in there.
Great.
One of them was hereditary. So when it
Mm-hmm.
says both parents,
Perfect. Perfect.
and another one popped up smoking in all capital letters.
Definitely. That's a key one.
Definitely. And then the third one was overweight, but they actually used the word obesity.
Okay. And overweight and obesity definitely can contribute. One that's a little hidden in there is oh, I'm sorry, I just lost my train of thought. Sometimes, so stress, sometimes some of our, other behaviors, our anxiety, other mental health conditions can kind of affect sometimes our blood pressure management. I'm glad you guys picked up on the weight. I'm glad you picked up on the hereditary. The other one that I want to touch on is that he's just eating a regular diet, not doing anything special, and we'll kind of dive more into that a little bit later, but you guys did a great job. So let's talk a little bit more then about modifiable risk factors. Um, and kind of go through and how those affect some of our common chronic conditions. And so our key ones that we'll be addressing are, conditions: hypertension, diabetes, overweight or obesity is what we see most common. So as you guys said, diet, exercise, he's doing pretty good exercise wise. We'll go through the actual guidelines, what he should be meeting, his weight, smoking, and we had some concerns about job as well. Some of his non-modifiable risk factors that did come up: family genetics was mentioned, which was great. His age does put him at a little higher risk to develop blood pressure, just because as we age, our blood vessels change. They aren't as flexible as they were, and so that puts you at higher risk. And also your sex can put you at higher risk for certain chronic conditions as well. So let's kind of take a dive in at diet. And this is such a broad topic that I'm just going to kind of hit some key points. And then if there's any specific questions, definitely feel free to add them to the chat. So diet affects so many of the chronic diseases, and it's really become a very hot topic of research lately. So a huge component is salt intake. And that's what I was getting at a little bit with a regular diet. Most Americans, we eat way too much salt, much higher than the recommended. If any of you have ever had your doctor talk to you about the DASH diet or how to work on your blood pressure through diet, they're having you target a salt intake of 2 grams or 1.5 grams, depending on your goal, or less. And that, if you're eating any sort of like canned soups, canned vegetables, that amount of salt can really tick up pretty quickly. And it's really key for folks who have any sort of heart issues to monitor that pretty closely. Another big component is your fluid intake. You want to make sure you're staying hydrated, especially depending on your physical activity. The amount of fiber, it helps keep the gut system healthy. Again, as Americans, unfortunately, we don't get all the fiber we should. Males are aiming for around 40 grams a day, women around 20, 25 for their daily amount of fiber. And the fiber helps kind of keep stools regular, helps prevent hemorrhoids and straining from constipation. So that's why it's important to incorporate it in your diet. This next bullet point here is really becoming a hot area of research in regards to your gut biome. As I'm sure many of you have heard, we all have healthy bacteria in our gut. That's why sometimes when you take those antibiotics for any other infection, it wipes out all that healthy bacteria that helps your gut function normally. Well, some of the research is finding that the better you feed that healthy bacteria in your gut, it's actually affecting some of your chronic conditions. There is some research suggesting that it's affecting your blood pressure control, is kind of where most of it has started pointing. But there's a lot of thought that it's playing a big role in other chronic diseases as well. And what feeding your gut biome kind of centers around is there's a thought that using more kind of pickled foods, a little bit more acidic, helps feed that biome. And then really just eating kind of the colors of the rainbow. So trying to eat a lot of vegetables, things with different antioxidants and vitamins to make sure that those bacteria have everything they need to kind of work through their processes to keep that gut healthy. The next big kind of bullet point I would say is really the cholesterol and sugar intake. As I'm sure many of you have seen, if you've ever just looked at the label, fat and sugar sneak into a lot of our foods that we don't really anticipate are even there. And they play a big role in our heart disease, in our diabetes control. And so, really, just being cognizant about how much you're consuming and just monitoring the portion control of each of those categories. One thing I'll say that I get a question a lot pretty frequently is, what about eggs? There's a lot of cholesterol in the yolk. Should I be eating eggs? Should I not? And really, the research has kind of gone back and forth over the last couple years. And so, really, just trying to keep in mind moderation is key. Eggs every day may not be appropriate for you, but once in a while is likely okay. And then, kind of the overarching category in diet is your caloric intake. And part of what comes into play is how active you are, and your caloric intake will change with age. So, again, portion control really helps with this category. And then something that sometimes slips through the cracks that may not get addressed as much as, what substances are you using? You know, you guys greatly pinpointed cigarettes as affecting blood pressure. We'll talk a little bit more about cigarettes themselves later about as a risk factor, but alcohol can affect blood pressure, sugar control, and does play a role in other chronic diseases, as well as any other sort of drug use or herbal supplements and vitamins. You want to make sure that everything is taken in the appropriate amounts because even some vitamins in excess can be worrisome. They don't play too much a role as in predisposing you necessarily to some chronic diseases, but it's something you always want to make sure you're discussing with your doctor. So we'll kind of move on. I just briefly wanted to touch base on some of the diets that are out there. Really a plant-based diet is what research is showing is kind of the healthiest for your chronic condition. So that doesn't mean completely excluding meat, but that plants are kind of the dominant portion of your meals. As I mentioned up here in the left hand corner, the DASH diet, again, it's more of a well-balanced diet and focusing on limiting salt. The Mediterranean diet, focusing on kind of the good fats, the unsaturated fats, limiting the saturated fats, and kind of avoiding more of the red meats. Up here in the right-hand corner is just a little graph about, again, the intestinal flora and the research that's coming through, kind of showing how it really does affect chronic disease. And then there is a lot of the low-carb diets that are around. Keto diet has become quite popular. And, just one thing I'll briefly say about the keto diet is I think it's something that you should definitely talk with your doctor depending on your health conditions before starting because it can increase your cholesterol and it could predispose you a little bit to being dehydrated. So it's something to keep in mind pending what other chronic diseases you have. So diet is a modifiable risk factor, but it's something that can help and also hurt. So next modifiable risk factor we're going to talk about is exercise. The general recommendation is 30 minutes of moderate activity about 5 times a week to total 150 minutes. So our gentleman earlier, where he was only walking a couple times a week, he wasn't quite where he needed to be. He also should be incorporating some resistance training about 2 days. Really, the goal overall is to move more and sit less. You want to just try and limit the time where you're really being sedentary. Now, I think where sometimes it's difficult is to come up with what actually is moderate exercise. What I like to tell my patients, and you can kind of see that on the slide, is you should be able to still talk and carry on a conversation for the most part while you're exercising, but it would be difficult to sing a whole song or you'd have to pause to take some breaths. You want to feel like your heartbeat is kicking up a little bit. And I've listed some examples about what moderate exercise would be considered. And again, this does vary with what your kind of baseline level is. So if you're a little unsure about where to start, I think again, getting in touch with your provider is important. But it shouldn't be something where you are feeling extremely out of breath, can barely talk. It's somewhere a little more in the middle. And then resistance training, I think, is a key risk factor that maybe isn't addressed as much as it should be because not only is it important for chronic diseases like hypertension, diabetes, because it helps control weight and builds muscle strength. It's really important for osteoporosis and other conditions because you're doing that weight-bearing activity that helps strengthen the bones. So I've listed a few kind of examples there and kind of what your goals are for resistance training. But it's one of those modifiable risk factors that can be a little harder to incorporate, but I think setting small, realistic goals for yourself really are key. One of the next big risk factors that comes up pretty frequently is weight. And it's hard to sometimes feel like, well, what does a healthy weight actually mean? You could be overweight, but still feel healthy and feel good. So it feels a little bit like a mixed message. And the way your doctor is looking at it right now is based on BMI. So 25 for BMI and above, 25 to 30 is overweight, and above 30 is obese. And really, what that helps your doctor do is decide what lab work do I need to start screening you for, or your weight has now become a risk factor for other diseases. And part of why that is because the extra body fat in your tissues, it does put you at risk for known diseases. So if you are having more abdominal belly fat, we know that that puts you at higher risk for heart disease, and also extra body fat as well. All the inflammation that can occur with that does put you at higher risk for diabetes and developing insulin resistance. And it's also been shown that weight puts you at higher risk to have high blood pressure. And that modest weight loss, about 10%, we actually do see a nice reduction in your blood pressure. Another condition that many folks battle with, your arthritis, having a heavier weight, more pressure on those joints does pose a risk. So sometimes, again, weight is one of those risk factors that we all know it contributes, and it's a little bit of a harder one to deal with. It's one that we have to kind of continually work on throughout our health journey. So, as someone pointed out, I like the all caps with smoking. Smoking is a huge risk factor for many health conditions. And part of that is because of all the chemicals, as I'm sure you all are aware, that are within the cigarettes. The exposure can lead to cancer and inflammation in multiple organs because of those toxins. And unfortunately, it's very addicting and very difficult for people to quit. So it's a risk factor that I think we all need to be encouraging for our friends, family to modify, because the outcomes of stopping are just so different than if you were to continue. And one thing I always like to point out is that, even if you smoked for a long period of time and you think, well, why should I quit now? I've always had this risk factor my whole life. What is 10, 15 years going to do when I've smoked for 40? And there really is evidence to show that even if you stop smoking after that period of time, you do have some benefit over if you were to continue to smoke. So it truly is a modifiable risk factor. It's not something that you've done so much damage, there is no kind of recovery. It's important to really quit the smoking, and we have seen improved outcomes. The other thing is it's a risk factor for you to get more preventative care testing. I know some patients feel a little bit hesitant with testing, and if you're kind of fall into that category, if you are a former smoker or you are continuing to smoke, you do have to go through a few more screenings than um, a comparable age group. So that would be more screenings for lung cancer, more screenings for blood vessel disease in your abdominal aorta, so that large blood vessel that runs in your belly. And again, as we all know, it just puts you at higher risk for other diseases and cancers. So lung cancer, mouth cancer, throat cancer, and really it seems to affect almost every chronic disease, especially your blood pressure, your risk for heart disease, and just disease of the blood vessels in general. So it's one modifiable risk factor that I think always should be at the front of our minds, how we can support our family members, our friends to really try and make a change. So the next modifiable risk factor is kind of environmental and job. It may kind of fall in between modifiable and non-modifiable, because sometimes, if your job is your livelihood, it seems maybe like that's one that really can't be changed. So it's folks who are exposed to different substances through their job, coal miners, if you've had chemical exposures, if you've worked a lot with certain animals, if you worked at a place where there was a lot of secondhand smoke back when you could smoke in restaurants, or a casino, or if you've had any exposure to radiation. The exposures can really affect different organs in your body, and it really just depends what that exposure was. And it may put you at higher risk for chronic conditions later in life. I always encourage folks, definitely let your doctor know what you did, if you're retired, what you did before, if you're worried about, I feel like I had a lot of exposure to something, bring it up. Sometimes that can get missed in conversation, so don't be afraid to let your provider know. And then another big factor is stress. And I don't want to say that we should write off our chronic conditions to stress, because there's lots of other things that contribute to these chronic conditions. But what does happen when we're under stress for prolonged periods of time, the hormones in our body actually do start to change. And those hormones do affect blood pressure, they affect some sugar release into our blood. So, being under prolonged stress is a risk factor for some chronic disease, and it's something through different techniques, whether that be meditation, just finding something you enjoy, that I feel like we can work to modify. All right. So, before I jump into the non modifiable risk factors, do we have any questions popping up?
Kelly, I think you're on mute. Oops.
Sorry, I thought I clicked that before I looked at the screen to check everything. But we do actually. Dr.
Okay.
Melo, we have a couple of questions. One was about feeding a healthy gut, and it
Mhm.
said to, you said pickled and colored foods, I remember that, but they were asking about supplements versus food items for a healthy gut. What would be
Sure.
best?
And so, supplements, I think what most people, when they think about supplements for a healthy gut, they're thinking more about a probiotic. And there's really, and I don't recall the exact probiotic off the top of my head. For the most part, there isn't strong evidence to say that probiotics through supplements are show any beneficial benefit. But I think so. Evidence really is more to work on a healthy diet. So I would say work on like pickled foods like kimchi, kombucha, and then just trying to, like I said, colors of the rainbows, trying to get your vitamins that way. Um, a multivitamin is generally safe for most folks and doesn't interact with other medications very frequently. So I would say stick to more of the diet. Sometimes those supplements or probiotics can be quite expensive, and there just really isn't good evidence to kind of back them enough to maybe incur that cost.
Okay. Can you hear me?
Yes.
Yes. Okay. The other question that came through, um, this person's a heart patient, and
Mhm.
they were concerned about the heart rate range they should be exercising at, that 3 times a week.
Sure. And what I would say is that would be something, I can't speak because I'm not sure about your physical abilities and kind of what your heart history is. And I would touch base closely either with your cardiologist or with your primary care doctor, to just kind of get their inputs, and they'll know your health history a little closer. For folks, it really just depends. So there is, as I think you're kind of alluding to, like a cardiac zone where you're doing a little more cardiac training. But we also, if your heart has had some weakness or a little more disease, we want to make sure we're doing that in a safe manner. So I'd say touch base more with your doctor. Um, and they'll also help you go through the calculation. Goal heart rate is based on age. Um, so I think the best answer I have for you is I would touch base with your PCP and let them know you're wanting to try and to boost up your exercise and knowing for a heart rate goal. But that's an excellent question, is knowing that goal, where you're trying to reach to, is very helpful.
Oops, can't hear you.
Okay. So we do have one more question. Somebody
Okay.
put in HTN question mark. That was on one of the
Oh,
slides, I
I
believe.
apologize. That's the abbreviation for hypertension.
And I don't have a question, but I do have a plug to make because I'm all about, quitting smoking. My father died from COPD, and it was one of those things. He taught health and he still smoked, for many, many years. And so I was putting a plug. There are resources, because quitting helps so many things. And we do have, if you look in our newsletter that'll come out in February, for the February issue, they're starting another Courage to Quit class. And that starts on February 8th. And so it's a great program if you're, I know it's not easy to quit. So we do have resources available to help you.
Great. And thank you so much, Tracy, for that plug. And one thing I'll add on to that is it takes most folks take many attempts to quit. So if you've tried before and it didn't go so well, or you quit for a while and restarted, you're definitely not alone. And I would encourage you to give it a try again. All right. Well, I will keep jumping ahead then. We're going to move on to non-modifiable risk factors. And so the first one we'll talk about is age. And really the key point here is that, of course, granted all the procedures that have come out, we cannot change our age. We are where we're at. And the screening tests that I'm sure you guys have seen maybe through the series are really dictated towards your age. And they're also dictated towards other risk factors, but it's always important to, see your doctor at least once a year to check in to see, am I due based on my age for any sort of screenings? Am I at higher risk? As we age, just because the cells in our body have gone through so much more turnover, that's why we become higher risk for other diseases like cancers, why we see those typically in later life. And our body has just had more exposure to different elements. And that's why it is a risk factor for chronic conditions. The other big risk factor that comes up is your family history. And really, it's what the family history indicates what you may be genetically susceptible to. This could include cancers, diabetes, heart disease, high cholesterol, and high blood pressure. It's important to, especially if you're starting with a new provider or if you're discussing a concern you have with your provider, let them know if you have a family history that's related to that issue. If you're really worried about your cholesterol and your mom or dad both had high cholesterol, or they've had heart attacks, or they've had bypass surgery, or your siblings had bypass surgery, and let your doctor know, because it gives us an idea of, you might just be a little more susceptible. And the other thing I like to say about that is sometimes, you may be doing your best with all your modifiable risk factors. Let's say you have high cholesterol, you've started exercising, you've worked on your weight, you've worked on your diet, but that cholesterol is just still not coming down. Part of it just may be your genetics, and it's through no fault of your own that it's sitting there a little too high. And so it's always something to keep in mind that there always is an element of our health that's just a little bit out of our hands. And another point that I'd like to reiterate is that a strong family history does not mean that a disease is guaranteed to develop. It just means that we should monitor more closely for that disease. I know sometimes for some of my patients, it can be quite stressful for them when they have a strong family history of certain diseases, and just letting them know that we'll monitor very closely, we'll make sure we follow the guidelines appropriately, but trying to put some of that concern at ease. But I'd reiterate, definitely always touch base with your doctor once a year, make sure your family history's up to date so they kind of know what's been running along your family tree. And so those are kind of the main risk factors that I had outlined earlier. So just to kind of summarize, our risk factors are important to address. Modifiable, non-modifiable. It's something you should kind of run through your mind if you're feeling like you're struggling with some of your chronic health conditions. And that way it gives you also a little bit of a talking point when you're coming back to your doctor as well, because you feel a little more confident saying, well, these are my risk factors. How can you help me change them? And I think it gives you kind of a jumping point. And again, some you can change and some you cannot, but that doesn't mean that we're not going to monitor them or we're going to ignore them. There's still a risk factor and something that needs to be addressed. But again, sometimes it's out of our hands. And really, the whole overarching umbrella, I would say, about modifiable, non-modifiable, is we're just trying to create healthy habits. And a healthy habit doesn't mean you are perfect 100% of the time. You're allowed to have cheat days now and then with the diet. It's about creating long-term healthy habits and trying to enjoy your quality of life as well. So risk factors are important, but also being able to get through your daily life without feeling so much pressure is huge too. So I want to thank you all for having me to speak with you, and any other questions that you have, definitely throw them into the chat and we'll go over them.
Well, thank you so much, Dr. Mello. I don't have any more questions in the chat section, but as soon as you said cheat days, my mind went to The Rock because he posts out his cheat days, and it's amazing to go, you eat that and you look like that. So it
Very
does give
true.
us hope that a
It
cheat day
does.
wouldn't be the end of it. I know I tease my parents frequently that the reason they're divorced is because genetically they were a terrible mix, so that I have all of these risk factors. And so I have made some modifications. And I do want to encourage people, like Tracy said, stopping smoking helps at any point in time, but
Mhm.
so do diet changes.
Yes.
Um, Cholesterol is the huge issue in my family, and I have found, as a non-meat eater, that I have not had such a huge problem with that. I've
Mhm.
made it a lot longer in life. And you talked about the inflammation, and people not realize how inflammation will play a part in all of your body structures. Our family has a particular degenerative cornea disease, and everyone but me has had to have that replaced. And they say that's because of inflammation that they've had to have surgery sooner than I did. So I do want to say what you're telling people, I can verify that.
Mhm. No, and I think those are great examples. And again, it's making those small changes and being able to keep them for a longer period of time. And that's really the hard part. But I always encourage my patients or, really anyone, don't feel intimidated to ask your doctor, how can you support me with this? Or I have a question about diet. And if you feel like maybe just with time limitations or whatnot, they're not being able to address your concerns, I think you guys have a great program about, going through diet. Certain chronic diseases, you can get an appointment with a nutritionist, usually at least one, to go through some diet planning, and some questions can get answered as well. So, don't be afraid to explore these questions with your doctor. Tell them about the risk factors you've identified, because I think it helps us know where you're really focused and lets us know how we can best support you. So,
We really do appreciate that. It's nice to know that the doctors really are on our side.
mhm.
And another thing that they always say is to bring your questions with you. Maybe the
Yes.
doctor can't take and cover that at that moment, but once
Mhm.
it's in your file, then it can be followed up on and dealt with. If you don't say anything, don't comment, don't put it in writing, you're not ever going to get any answers. So do
Right.
be assertive in that respect when you go to your doctor. They're there to help you and to serve you to the best of their ability, and they can only do that if you truly ask.
Right. Right. Very true.
All right. Tracy, do you have any last minute comments?
No, I thought that was a wonderful program. I really do like seeing an example of a patient and what you guys see,
Mhm.
when a patient comes in. And it's a puzzle. I know you're trying to put
Mhm.
together all the pieces of the puzzle so that you can best treat the patient. as Kelly said, you don't have all the if you're not telling and talking about those things, then you don't have all the pieces of the puzzle. And if you're like
Right.
me, that's kind of, I can't stand with it when a piece is missing, you know, so. So
Well,
Very true.
what's your story? Bring your story to your
yes.
physician.
And
So,
be honest. Go ahead and
Mhm.
tell them. It's not like it's going to be hidden. You know, if you
Right.
eventually have this issue with eating too much fat or your triglycerides are out of whack, they're going to know it. So you need to be honest and inform them of everything so that they can make the best choices for you.
and I'm
Very
sure
true.
you think being upfront ahead of time so they can do something ahead of time before
And
something bad should happen.
I always tell my patients, kind of two things. One, it's probably nothing I haven't heard before, so don't feel embarrassed. And if you can't be honest with your doctor, then well, who can you be honest with? So, everything generally is private and confidential. So I really encourage, folks to just be honest, ask your questions, and, it really helps build the team.
Well, thank you so much, Dr. Mello. That really
Of
was
course.
great. I did like the example, and I liked it when you gave us a chance to think about it, and people were able to
Mhm.
do a little interaction, even though we are doing this virtual
Yes.
today. So
All
thank
right.
you so much. Tracy will be able to end our live stream here, and we will see everyone as soon as we can in person once again.
All right.